In this episode of the Boost Numbers podcast, we will discuss an urgent healthcare challenge that aging populations face: taking a fall. A simple fall can significantly impact a life due to injury, loss of independence, and the emotional and financial strain on their families. And this is where Gracyn Robinson, founder of Renova Health, comes in. Gracyn and her team are developing solutions to revolutionize aging in place. Yeah, let's learn what Renova Health is doing to aid in fall prevention. First of all, Gracyn, welcome to the podcast.
Thanks so much, Bill. It's a pleasure to be here, and I appreciate you inviting me on.
Yeah, we're glad to have you here because healthcare, it's super complex. We think a lot about technology and tools and medicines and a new pill, just all this excitement. It's very rapidly moving, but really just something as simple as someone tripping and falling can have a huge impact on their lives. And I know that's what Renova Health is focused right now. And as before we dive into that, I thought we would just start with hearing a little bit about your background and, of course, what led you into creating Renova Health.
Yeah, sure. So I came by way of personal experience, which is common with a lot of founders. My mom had her first fall at age 68. She went on to have 5 falls in 7 years. I did not live nearby my mom at the time, and my background is in interior design. I was working for a senior living and healthcare design firm, ironically, up in Massachusetts. So it was an urban planning, master planning, full continuum of care, architecture, interior design firm. So one of the leading memory care entities in the country. So my mom had this first fall when she was 68. We know that 80% of falls are preventable, and 1 in 3 older adults age 65 is going to experience a fall at some point. And the statistics um, are really glaring. I mean, we also know that CDC has studies showing that every 19 minutes an older adult is going to die from a fall within their home. These numbers are only going to rise as we look out to 2030, given the number of boomers that are now reaching 80 and upwards. So it just really came by way of personal experience, and I decided I was we were drafting at the time. The tool that we used was ArchiCAD, Graphisoft, and which is a 3D point cloud computing tool where you're in model space from the minute you have where you enter that first coordinate, you're in model space. And it just occurred to me it would be so much easier to have an app that would be able to help take a capture of a scan utilizing digital twin technology, and then be able to conduct a wayfinding and fall hazard analysis of a space, itemize where those hazards are for mobility within a given space, and then link the behaviors, so the activities of daily living, with the desired outcomes as it relates to that specific point, that hazard spot, and then pair them with accessible design and injury prevention solutions. So I went back to Brown to get master's in healthcare leadership during the pandemic. And so I really set out to develop and design this technology. I took out a 83-page pending patent that's on file with USPTO. It's been in queue for about 3 years now. So vision canvassing began in November of 22. Vibe coding did not exist at that point in time. This was pre-vibe coding. So my lead technical developer is down in the Providence, Rhode Island area, and we began working on our MVP uh, in March of 2023. We reached MVP 3 months ahead of time. We worked nonstop around the clock. You know, very grueling long weeks, and we reached MVPs 3 months ahead of time, so we arrived at that point in Q1 of 24, and then, of course, just as we reached that moment, a lot of the really investment acceleration in LLMs began to occur.
Mhm.
And so now, since that point in time, it has been a lot of reconciliation in the background because we have a core stack that's part of our, we have 7 different components of our core technology stack. And so there just have been some issues that have arisen as these LLMs have taken off and as certain LLM entities such as Anthropic and ChatGPT, some others have kind of formed some strategic partnerships with various entities within our stack. We've had to just do some workarounds because what happens is it can, with every single release that occurs, whether it be Grok, it could be ChatGPT, it could
Mhm.
be Claude, as different releases occur, if there are components within a tech stack, the tech stack has to still talk fluidly within its structure. And so you just have to be aware of kind of what's going on in order to make sure that your technology is working as it was originally constructed. But yeah, that's kind of where we are now. And now we're able to deploy obviously on Android. We're in Apple developer, we're in Android developer, we're in Samsung developer, Meta developer, NVIDIA developer. We are an OpenAI developer. So we're kind of now in a lot of these different tools. And it's an exciting time because, as we know, Apple Style Vision is
Mhm.
working very quickly to get their glasses to market. And then, in addition, obviously, Meta is really kind of leading the way with their Ray-Bans. Um,
Mhm.
and they're already in their Gen 2, but we began working off the Quest 3 about, gosh, I'd say about 15 months ago, and it's really my preferred way of working because we're a spatial application. And so it's just easier for, traditionally I work off desktop, but the best way for me to see spaces within our platform is in an actual spatial headset. So heretofore that's been the Quest 3, and it's been exciting. It's an exciting time to be in this space because things are moving very quickly.
The journey is just multidimensional as you describe it, when you start from personal experience and then just the time that you dedicated to get into the healthcare space. And then, of course, the tool set, you probably couldn't pick something, I wouldn't want to say more complicated, but there's a lot of pieces that maybe aren't in a typical app development, particularly today. You mentioned Vibe. I've seen CEOs code up an entire financial system with a tool like Anthropic and say, I don't need accountants anymore. Yeah, it's unbelievable what it's done for development. To your point about the actual platform being ahead of schedule and then need to kind of go back and retool. So I did want to, you shared with me before part of the personal journey that I found fascinating. I think with one of your parents had fallen and you were, I believe, in an ambulance for somebody else and kind of caught, we talked about the sandwich generation. So I'd love to, before we get into the AI and the 3D modeling and all the good stuff for helping the falls, I just thought it was a great story if you don't mind sharing.
Yeah, sure. So the fifth fall that my mom had within that 7-year time frame, my parents had actually moved into a rental
Hmm.
down in the Washington D.C. area, and it suited their needs at the time. However, because it was a rental, they weren't able to make certain modifications to it that they probably should have. And on the actual day that they were due to move from that area up to New England, they were you know, the moving truck, all of their things were ready to go. My mom was coming out of the rental, and it had a stone step, um, and then a couple pavers, and she lost her balance, hit her head on a flagstone paver. My father called me as my mom was in the ambulance, going to Georgetown University Hospital, and he said, "Grayson, I'm in the ambulance with your mother. She's just had a fall." And I said, "I can't believe this, Dad, because I'm in the ambulance with I've got 3 kids." And I said, "I can't believe you're calling me from an ambulance when I'm right now with one of my own children who has, her own
Mhm.
healthcare need." And it was a sliding door moment of kind of epic proportions because, I was just I couldn't be in 2 places obviously
Right.
at once. And fortunately, my mom ended up being okay, but it took her months to recover from that fall, and she had a contusion on the back of her head that was there. I mean, her whole face was black and blue. She had an egg on the back of her head for, I don't know, probably 11 months. I mean, her recovery took a very long time from that fall. And then she went into a relatively quiet period where she didn't have as many falls. And I don't really know why that was. And I'm grateful for it now. She's 85. She's been having a few more falls. But generally, these falls, they occur predominantly outside. So they're in
Mhm.
settings that she can't predict where they're going to occur, and she just loses her balance. Or she was at a convenience store in Maine, and it was wintertime, and they had put a mat
Mhm.
outside of the door to go into the convenience store, and it was a mat that had a lip that was greater than a quarter of an inch. And she's very lucky she didn't fall through the glass front of that door as she slipped on the mat. So I think it's just a matter of awareness reaching public consciousness that A, we have an aging society, and we're not alone in that. This is a global problem. And B, universal design is critically important to accommodate the needs of multiple ages and abilities and disabilities, and how we're going to meet that need in terms of public spaces and wayfinding. And then obviously you've got your own space where someone lives, but it really, it's a very common problem. And so it propelled me to find a solution. So we've got the capture component of the technology, then we have the linking of it with the behavior and the desired outcome, but then we have a whole spatial commerce component that we've been building. So I've had to, build the website, do a 1.5 website, a 2.0 website, and then beginning to uh, import products that we are now, and then begin to build strategic partnerships. How are we going to do that with certain products or product lines that then we can import into those spaces?
Mhm.
And spatial files are really only beginning to get cataloged in an easy capacity. A lot of companies don't carry their products in spatial formatting. So when you just said earlier, this must have been a complex build, it has been. And there have been multiple moments in this journey where I have just said, what was I thinking in
It's not funny,
in
but
taking this task on? But then, I've just tried to keep at it. And now
Mhm.
I will say that between 22 and 24, uh, I- it was a painstaking endeavor. Now it's different. I mean, now everything's been built.
Mhm.
It's ready to be deployed. but there have been other issues that have crept up that I couldn't have anticipated at the time of the initial build. And now there's vibe coding. And, you think, well, wow, I invested so much into this, not only of my own time in terms of creating the user stories with my lead developer, who put equally as much time and devotion into it in out of his life. And we really dovetailed one another. But there are just so many technical components to it, and then no sooner do you build it, and then AI starts to take off, and then you hear about, okay, well, now technologies can be built in, I don't know, a day. I don't vibe code, but
Mhm.
I do think that the amount of thought that and the feedback back and forth between myself and Keno Mullings, my lead developer, and his team. I mean, he had an entire team that he brought on to this, to the I'd like to think it's kind of comparing it to skiing and then snowboarding, and then you've got
Mhm.
some mountains that are only dedicated to skiers. And it's not to say that snowboarders don't matter. Of course they do. They add a tremendous amount to mountaineering and mountain sports. But it's just that maybe people fall into one camp and not
Mhm.
another, and then you've got those that fall into both camp. I just haven't had time. I've been so busy tending to our own platform. I've had no time to kind of put my feet into the vibe coding pool. So maybe that's something I'll do way down the road. Who knows?
There may be a day in the future where you could develop the whole thing on your own, but having dabbled in that and you see some amazing things, but then, there's a long way to go. You're also in the 3D spatial world, which is, I think, a good thing because it was a little bit of a science experiment a few years ago. Now I run into more and more people that they're wearing the meta glasses, and as you said, Apple's turned a corner, and we're all gonna be wearing these things soon, one way or the other, because they're gonna have so much utility, which brings us back to where you are, and working in that 3D space and modeling this out could really help folks out, whatever form it takes for helping these folks out in their environment. You could see a future where you could have this utility designing the home to be safe. And I just wanted to go back to one thing you mentioned, 80%, of people, will experience a fall. Did I get that right?
Yeah. CDC has this. They come out with a study every year in terms of fall statistics, and so 80% of falls, 80% we know are preventable. It used to be one
Preventable,
in
yes.
four. So it used to be 1 in 4 older adults would have a fall, age 65 and up. But because the numbers are ballooning so quickly because of being in an aging society, it is forecasted to be 1 in 3 older adults age
Mhm.
65 is going to have a fall within the home. And then, every 19 minutes, an older adult dies from a fall within a home. The other thing is the amount of time, the cost that, because when a fall occurs, that person lands in the ER. They don't
Mhm.
go to their primary care physician, they go to the ER. So the amount of time when you have, 1 in 3 is going to have a fall, 80% are preventable. They're winding up in the ER. The amount of just the cost of that care provision within ERs throughout our country um, is anticipated to exceed 180 billion. I mean, it is a
Mhm.
huge number, and so if we can get ahead of it, so that people become more aware of more aware of their built environment that they're
Mhm.
inhabiting on a daily basis, so that they can stem the tide of their risk ratio that's very real of them falling, then how might that lessen the emergent care arrivals and the cost that's associated to it, whether it be with insurers, it could be with payees, Medicare. I mean,
Hmm.
Medicare is now, so there are 140 million homes within the United States that are ill equipped for aging in place.
Yep.
And then Medicare is now helping to shoulder the cost of home modifications. And when someone has a fall, um, home health agencies have to send someone, a PTOT goes into the home. They are they have to conduct an assessment to figure out where those hazards are before that individual returns to their home, because they want to make sure that that person's going to be safe in order to be able to continue healing from that fall.
Hmm.
So it was originally constructed, well, let's try and get ahead of these falls, but prevention historically, and someone at USPTO and the National Inventor Club reiterated this. They said, it's kind of difficult to grow a business on prevention, because a lot of times what's going to happen is it's going to happen regardless. So you may want to think about it more in terms of, well, how you can assist people after that first fall. But the problem is that when a person over 65 has that first fall, their likelihood of having that second, third, fourth fall goes way up. So I, I guess it can be a before and after tool, but my initial desire in creating it was to try and get ahead of it from occurring for that first time, because I just saw what happened to my own mom. And it
Yeah.
is risky because, you could equip your own home, you could do that analysis, but then you could go to someone else's home and not have they might not have any idea. Hopefully, if you've gone through that exercise of becoming more knowledgeable about where those risks occur within your own home, when you go out and you go to someone else's home, you might think, in walking through a space, oh, something, if I'm unsteady on my feet, maybe I don't, maybe I want to go around that area rug, or, maybe I am going to hold on extra tight to the railing as I'm going up a stair. But I, I, I think we're going to start to see public spaces that are going to become more acutely aware of ways that they need to accommodate universal design. And most certainly at the commerce level, Lowe's Home Improvement, I mean, they have an entire product line called Lowe's Livable Home. And they actually recently partnered with Apple, and Apple's Style Vision is now being piloted through the Lowe's Style Studio pilot project. And I think it began in Austin, then they did it in California. So it's slowly, now they don't look at health needs. They're really looking, let's just say someone wants to redesign their kitchen. You can put
Mm-hmm.
on the Style Vision headset, and you can begin to pick out, which pendant fixtures you want to have. What is the type of hard surface that you want to use? Do you want to do laminate, marble, whatever that cabinetry or counter surface could be? You can now just click through it and kind of go through and see all the different offerings that they provide and how it would look. And then you can do your, bar stools at the whatever it might be. But it's cool to be able to go in and now see it, and it provides a whole new way mm, for people coming in to that type of setting that are looking to make upgrades and modifications, and say, okay, well, now this is exactly how we want it, and we can see how it's actually going to look in a much more accelerated time frame that would have occurred in the past, where you'd have to wait on renderings, and
Mm-hmm.
that could take time. So it's it's an exciting time to be in this space, because things are progressing very quickly.
Agreed. Technology is moving very quickly in that space, and these applications of that technology are probably unknown to a lot of folks. If you're in certain industries, there's a growing use of kind of these AR, VR tools because they just fill some small gaps. But when you think about a lot of people owning these things, millions and millions of people having some version, and then being able to now use those, have a real utility in life versus kind of fun, cool apps. It'll open folks' eyes. And I just wanted to restate, the importance of some of the things which led to what you guys do at Renova today. When someone does take a fall, um, there are cases where folks bump their head and they're not with us 3 or 4 days later, but they think, "I'm okay. I got up off the floor." There's the emotional impact on families and friends, like if they're in their home and do I need to move home? Do I need to move them in? That creates a whole series of life decisions and events. And of course, you pointed out very clearly the cost to the US healthcare system and probably many others around the world. And we all know if you're in healthcare, the US healthcare system needs to find a way to not be as costly. And that's keeping people out of ERs, number one. And that's a huge impact for a health system to try and solve these issues. So it's significant, and you really don't think about it till it happens. And if you've had kids, you go through your house with a fine tooth comb and get it nice and safe. And you kind of almost have to think about it in that way for aging parents or family and friends. So today, what Renova would do, because we talked about a ton of technologies and development, but just kind of wanted to clearly summarize the capabilities today. As you said, the application is out there, it's complete. You've got partnerships with manufacturers and vendors that make some of the necessary equipment like chairs or beds that are accessible. So today I could contact Renova one way or the other, and you guys have the tools to run an assessment and a design and to some degree maybe place new furniture. As you pointed out, not everything's available as a 3D model, and hopefully that changes over time. But this is something that you guys can do for people today, looking at their home living space and give them a nice assessment of where they are. Is that correct?
Yes, that's correct. We are able to send in teams to be able to take that scan, upload that data into. It depends on obviously the size of the home. It could be a single space within a home. If it's just a
Mm.
single space, we can, and they're working off an Android or iPhone, we can help walk them through the tool that would enable them to take the scan. If it's going to be a bigger space and dwelling, we are able to provide a team that can go in there,
Mhm.
would take that capture of the space. We then upload that data into a protected cloud. We then run the analysis to look for the wayfinding and fall hazards that are within throughout a house. It's important to stress that humans will be looking over that to run that type of analysis. But then in terms of the product feeds, based on and then obviously budget as well, you have to take into consideration someone's budget. We can then start to enter those queries into some of the channels within our tech stack, and AI is able to assist from that point on to help make certain product recommendations. Then we are able to contact teams for installation and conduct an assessment if necessary, a risk assessment. And then what we would want to do is perform what's known as a POE, so a post occupancy evaluation, just to be able to see, all right, how are things going for you within your home. We also, in terms of, it's really a B2B a B to B2C model,
Mhm.
and so whether we work with home health agencies, contractors, certified aging in place specialists, you've got home assessors that are going to need to be able to come in and take a look. And if people are looking to maybe downsize from their home into a smaller space, and perhaps you've got an older adult child that's helping their parent make that move, that's going to be important to them, that they know that these features exist within the home that their parents are going to be moving into. If they're going into a senior living community, a lot of these senior living communities they're already equipped with these features. I mean, if it's assisted living, memory care, or skilled nursing, the Facilities Guideline Institute has very strict standards that communities have to abide by, and room typicals would need to follow. So just by code, they would need to be incorporated into that care setting. But a lot of senior living communities, they have independent living components to their community. So people could be living in a cottage, a two-bedroom cottage. And if it's a legacy holding for that senior living community, they might need to make upgrades, or it could be up to the individual or couple that's moving into that cottage setting. And they're going to want to make improvements. So it's a tool that can be used by teams uh, within a senior living community. And then you would have the facilities management, whoever handles facilities management for that community. They oftentimes have their own tradespeople that they use internally. So we would be able to work, they would be able to be brought in within um, the the team portal. We would be able to upload that resident, their family member, anyone that is really playing a part in terms of the constellation of that individual's uh, transition into that setting. We could actually also include care providers in there. I mean, I think that's,
Mhm.
if we were to get the right funding, that's aspirational to then, take it to that next level. But we're really coming at it from an analysis of the built environment, and how can we make those upgrades so that we reduce that risk threshold for that individual.
Uh, The idea of a kind of that platform, I'll call it an IT approach just to try and simplify it. It would be appealing because having just even personally kind of gone down this road, I have 2 situations, and one, they resolved with a lot of railing because one of the individuals there is very capable and installed everything and kinda quickly after an incident. Then another where they just didn't do that. It's a very similar situation. Who do you call? Where do you go? Do I find specialists? Do I find a handyman? You just don't know because you're guessing it, and if you fell, you might oversimplify and try and quote unquote self-diagnose what's going on, and that's just not going to work, and it's difficult for everyone involved. So the idea of a platform coming in and objectively looking at a space and then here are the options of things you could do, I think is a great way to do it versus trying to call a vendor that only does bathrooms, or then, well, what do I do about the living room? It's just a really big complicated mess for folks trying to solve it versus using a tool that's going to know a lot more, and particularly over time. So it's really just a great application, Grayson, driven by your kind of passion to in need to try and sort this out based on your own personal experience. It's that true kind of founder, mentality. I ran right into this problem and I'm going to fix it. Once you've gone down this road with yourself, or you realize this is that it should happen, at some point in everyone's life, like someone should just do an assessment of where you live so you don't have this issue because it can be, very dangerous. So I really appreciate you sharing the journey. It's been a long one, but you're here. You're out with an application. That's job one. Get it out there in the
Thank
world,
you.
and
Yeah,
yeah,
for better for worse, I'm in it now. So
yeah, you're
it's
in it.
kind of
That's
like
great.
this, when you're on the skis and you're looking down that slope and you think, all right, do I go in? Do I not go in? And then, yeah,
Yeah,
now we're well down that
yeah,
that slope, heading towards,
yeah.
well, I don't want to say heading towards the bottom, but hopefully my I just hope that people don't have to go through
Mhm.
what I went through. And so many, so many older adults and kids, they don't live nearby their parents. And so it's not an isolated incident. Many people experience this. And if we can just even reach, a few people and then
Mhm.
it begins to grow, we're starting at the local level. And we do have grants of protection in a couple of areas outside of the United States. And we have some strategic partners, some MNDAs that have been executed, which are exciting. And now, really, it's about going to market and scaling, and then getting the tools in the hands of people so that they can, you know, be better equipped to reduce this risk and just have a heightened awareness of the problem.
That's great.
So,
Well, I'm sure it'll become a success. Just the overwhelming need once you're in it will, I think, pull it right along. So again, thanks so much for the
oh, you're
story.
welcome,
Anything
Bill.
else you'd like to add? Any other final thoughts you want to share? No pressure.
No, I mean, we're taking signups for an initial pilot. So,
Okay.
if anybody is looking to sign up and use our technology, please feel free to reach out to us at info at Renova, or test at renovahealth.com is where you would sign up. And then feel free to come to our website, renovahealth.com, reach out to me, and we can hopefully go from there. And we
Yeah.
invite you to join us in our journey of
Yeah. Take a
revolutionizing aging in place. So,
take up the offer if you're out there because this type of tool, I think once you use it, wow, didn't even know this was possible to help me out. So thanks for offering that up. And again, thanks for joining the podcast. It was a really great
you're
discussion.
welcome, Bill. Thanks so much for your time, and I look forward to hearing from you.
Thanks again, Grayson.
All right. Thank you.